Dr. Kevin Kavanagh is a retired physician and also founder of an organization called Health Watch USA. He has been kind enough to be our go-to guy for this whole pandemic, which seems to me at the beginning, if I'm not mistaken, you can correct me, Kevin, if I'm wrong, but didn't we think we'd be doing this 2 or 3 weeks? Little did we know.
Yes, it's continuing. And at this point, we really don't have a winning solution to say when it's going to end. I mean, the virus is mutating. People aren't exactly following public health advice. And all of this is putting us at a disadvantage for predicting when it is going to stop.
Wow. It's, yeah.
Yeah, I know that's not good news, but, you know, rates in Kentucky are creeping up. They're not going down, and that's a problem.
And not only here, but all across the country, they're creeping up, right? Mostly.
That's correct, especially Michigan. Michigan right now has a higher rate of infection than what they had over the holidays, and that is very disturbing.
Okay, almost 10,000 appointments are open in Kentucky, so if you want to get the vaccine, there is no reason for you not to, right? I mean, we've got the stuff, even without the Johnson & Johnson product.
That's correct. And I think that the big problem with the Johnson & Johnson product announcement was the vaccine hesitancy that it fueled. And we need to overcome that. These vaccines are the solution to both the wild type and the UK variant. And if we get vaccinated and quit spreading around the virus, the other variants won't invade the state, and a booster for those will be out in this fall. So we do have a winning strategy, but people need to embrace it because this virus it's like a predator and it's mutating. We know how to protect ourselves, and why people aren't doing those steps, Jack, is just beyond me at this point.
I'm scratching my head too. I know people are sick of it. I know that. I get it, and I understand why. But as you have said countless times, Dr. Fauci has said the same thing. We're so close to the end of this race. Don't quit now.
Well, yes, and there was an exchange between Dr. Fauci and one of the legislators yesterday regarding, tell us a number when we can quit. Well, it's not really a number. It's a behavior. Because even if the virus cases get very low, and we've seen this in the past, if people don't take the virus seriously, if they don't change their behavior, it'll just come right back. And it's also mutating, so it's an ever-changing adversary. It's hard to give guidance when 1 month versus the next, you're up against an adversary that has different tactics. So it's mainly a behavior that we have to change. And if you look at countries that have handled this by embracing public health advice, which is New Zealand, Australia, China, Taiwan, South Korea, they are doing quite well. And they are open. They have returned back to almost a normal daily life. And that's something we have to shoot for. But Jack, it's really going to entail the public changing their behavior. If we're still at the level of, masks don't work, virus isn't that dangerous, and I'm not going to get the vaccine, we're a long ways from being able to open up safely. Because if we do, the virus will just come back.
Let's go to the phones. Laura, good morning. You're on with Dr. K.
Good morning, Jack. Good morning, Doctor. Listen, I was wondering, the Johnson & Johnson vaccine is it only affecting women all over the world, or is it just in this country, the 6 cases we've seen?
Well, right now, it's just in this country. There's only 6 cases, very, very few cases. And you're talking about a proverbial less than 1 in a million chance, even if you're in that high-risk category. Compared to the coronavirus, right, it's much safer.
Right. Now, what I was wondering, does it matter? I understand I had nursing school 20 years ago, so it's a little long ago where I'm getting my screwy ideas from. But does it matter if a woman has had children and how many children she's had? I know women have a whole lot more problems with autoimmune problems because our immune system has to avoid hurting babies.
Yeah, what I was going to say is that we really don't know. There's only been 6 cases. One person died, unfortunately, which is extremely tragic. Any death is tragic. We had another that's in the hospital, and 4 others that have been able to be treated out of the hospital. So that's too few cases to come to any conclusions other than they're probably more likely to happen in females than males. This is an extremely rare event. As I said, if you look at the deaths, it's less than 1 in a million in this cohort of patients. Overall, it's 1 death in over 6 million doses given, and that's both males and females. So this isn't something I would be concerned about. I would be more concerned about the 550 plus thousand deaths from COVID, let alone the additional people that have developed long COVID. So to me, I think it was a bad decision to keep from distributing this vaccine. Certainly in rural areas and in areas where it's difficult to get this vaccine into arms, it is very problematic.
Okay, here's a good question. I have a homebound 95-year-old mom that wants a shot. She's been waiting on the J&J shot. No one is going to homebound people giving the other shots, the other vaccines. Any suggestions?
Well, I would try calling up your health department and seeing if they can't send a nurse out to give the shot. But that's one of the big advantages of the J&J vaccine is that it's only a single shot, and transportation to the doctor is a huge problem for many, many people in rural Kentucky. So getting down from 2 visits to 1 visit is a huge advantage. So I would contact your local health department.
And Drew is on hold. Drew, thanks for holding. Good morning.
Good morning. Suggestion, since it's the women that are having problems with the J&J, what about just giving the vaccine to men?
Well, that's a very good idea. That would be, I think, the fallback position. Certainly, if I was a woman and had the choice of vaccines at this point, I would pick the Pfizer Moderna. But to not give out this vaccine and to hold it back, because in some areas of the nation, for example, Michigan, they don't have enough doses available. This is just going to fuel the pandemic, let alone the messaging that gave to the anti-vaxxers is fueling vaccine hesitancy.
Right. That's what I was afraid of. And just giving them fuel. Okay, we're going to try to take another call, and I will forget trying to take calls if this one doesn't work. Let's try it here. Robert, good morning.
Yeah, on NPR last night, they stated that there was a man that came down with symptoms from the J&J as well.
Same.
And the vaccine,
yeah.
The virus is breaking through on the vaccinated population. And there was something on NPR and BBC a couple weeks back about the virus was actually driving mutagenic forms of the virus. The vaccine was driving mutated forms of the virus as well. Of course, that doesn't fit the narrative, so we're not going to hear more about that.
All right. What do you say?
Well,
yes. Well, that's actually not the case. There have been a number of articles on that. You can get infections with the vaccine, which means the virus can still mutate, but it's going to be less than if you didn't have the vaccine, because again, when you get the vaccine, you will not be spreading the virus as much. Now, with the wild type virus, the vaccine actually snuffs it out. The rate of spreading the virus is very low. But with the mutations, especially the special tier, what we call the EEC mutations, you can still spread the virus with the vaccine. And anytime the virus spreads, it has a chance of mutating. But if you catch the virus without the vaccine, it's going to spread more. The vaccine does not inhibit your body from snuffing out the virus. So you'll be in a better situation if you get a level tier type of a virus if you have the vaccine versus not being vaccinated. So can it mutate with the vaccine? Yes, but it's less likely to. That is one of the reasons why you need to get the vaccine.
Here's one that says, I'm almost out of time, probably shouldn't even bring this up, but it says, got my first shot March 17th, was due for my second after April 6th. Family member tested positive April 3rd. I tested negative. Health department put me on quarantine April 9th through the 20th. I got the order April 5th. Family members have been released, but I haven't. I don't understand since I tested negative and have gotten a shot. What does this person need to do?
Well, I would call up your health department, but certainly when you're out of quarantine, if you didn't develop COVID, when you should get your shot, if it comes up, you need to get that second shot. That's for sure.
All right, as always, we appreciate you very much. I hope you have a great weekend, and we will get back together with you on Monday.
Thank you, Jack. I appreciate it.
Dr. Kevin Kavanagh.